You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, big topic, the end of back pain. With us, we have an expert on the topic. With us, we have Dr. Amol Soin. Dr. Soin, welcome to the program.
Thank you for having me.
Now, you're president of the biggest interventional society. Tell me about that.
Yeah, I'm currently president of the American Society of Interventional Pain Physicians.
Okay.
It is the largest advocacy specialty for our patients and physicians in our field of pain management.
Okay, good. Now, we've invited you on the program today to talk about two specific therapies to reverse pain. Spinal cord stimulation that I guess actually blocks and confuses the signal to the brain.
That's right.
You've helped me understand this.
Yeah.
And then this other procedure for people with spinal stenosis. We're going to get into those. But a little bit about you. Because in Dayton, I mean, you are well known. I mean, you have hospitals named after your parents. Is that right? The Soin. Tell me about this.
Yeah, so truly a big honor. You know, my parents came to America with just a dream, the American dream, and they were able to realize that dream. And as a result, they've given back to the community. Soin Medical Center, a full-service hospital in Dayton, Ohio, is named after my parents.
Nice.
You know, and it really is an honor for me to live out their legacy, and it's an honor for me to service this community as a physician.
Okay, good. So you have two medications that you put together.
Yeah.
For pain that are in what?
In FDA trials,
Okay.
I've actually invented two new types of pain medicines with two completely new and unique mechanisms of action, or the way they work is new, and they are non-addicting, non-narcotic. That's exactly what we need in our current state of affairs in pain management, are more tools to treat pain without addiction.
Okay, now, this ASIP, as you call it, the American Society of Pain Physicians, right, International Society, that what separates you is, I guess the goal is no drugs and surgery. Is that fair to say?
You know what our goal is? When it comes to pain management, our goal is to manage your pain without addicting painkillers.
Okay.
Really to understand and find out what is causing your pain. Let's treat that cause instead of mask your symptom with a drug, a pill, or some foreign substance. And there are a lot of ways to do that, and a lot of ways that could be quite helpful for people that suffer.
Tell me about your center for patients in Dayton. How many centers?
So I have two main clinics. One is on campus, the Soin Medical Center in Beaver Creek. Okay. The other is our other office in Centerville, Ohio. So, you know, kind of covering the broad Dayton market between those two geographic areas.
Who are the typical patients that you see, pain patients? Like, what kind of problems do they have?
Well, I got to tell you, the most common reason that someone goes to see not only me, but any doctor in America is actually chronic low back pain. So low back pain, right? So that's a thing. But actually, we treat all sorts of pain. Neck, back pain are the biggest, followed by joint pain. We also treat migraine headaches. We have some unique therapies for that aren't necessarily available in other places. We also can treat abdominal pain. Basically, if you have pain, a lot of times we may have a solution to help you.
Now, a lot of people, you know, knowing you're going to come on the program, a lot of people don't know that your specialty exists.
Yeah.
Is that a bit of a challenge?
It's a unique thing because
like insurance covers it.
Yeah. Oh, it is. Yeah. The techniques are covered by insurance. So many things that we do are FDA approved. They've been through all these studies and tests. But as a specialty in medicine, pain management is a relatively new field.
Is that right?
Yeah.
So the interventional pain management docs is a fairly new field too, right?
Correct. Yeah, especially this whole concept of treating pain without addicting painkillers. You know, we have an opioid crisis. We have it in Dayton. I think everyone watching this program probably knows someone directly or indirectly that had an issue with opioids. Before, that's how we were treating it. But now it's a new day.
There's new things.
Yeah.
Interesting. Now let's jump right in. So this spinal cord stimulation, because opioids are hot in the news, everybody's talking about it, they know there's a problem. Does this spinal cord stimulation, this non-drug therapy, do you have people that were able to get off, wean off, or get off completely opioids?
All the time. And truly, that is our goal up front, is to see that patient and say, look, we have other options for your pain that will do two things. One, I believe it will be more superior than what you're doing right now. And two, we can get you off a lot of these medicines. Medicines have side effects. They go through your liver, your kidneys. They can cause a lot of problems for your body. If we can just find other ways to treat your pain by treating the cause, the mechanism of action of pain, that might be a good thing.
So you say there's a lot of side effects, like constipation being one of the big ones.
Oh, especially if you're on an opioid, constipation, sedation, having that brain fog, you know? Maybe you'll run a red light. Maybe you'll leave the oven on. I had a patient once who literally told me she had a funny smell in her kitchen and she put her milk in the oven as opposed to the refrigerator.
Okay.
And that was attributed to all these drugs that she was on. She was living in a brain fog.
So these medications work for people. I mean, there's the addicts, but we're talking about people that are legitimately in pain. They work. And everybody that's on them, nobody wants to be on them, right?
Yeah.
But that's their only choice.
Correct.
Until now.
Until now, we have other options. And those medicines do serve a purpose. And they are important, and they're definitely needed for some people. I guess what I'm trying to say is that it's important to look for some alternatives as well. And maybe we could get to a better place than you were before with just the drug.
Because they are progressive, right? I mean, you have to keep taking a little bit more.
Yeah, because
them to work?
That's right. You start to develop tolerance. One pill doesn't do enough, then you have to do 2, then 4, then 8, and then you look back, 4 or 5 years, and you're like, how did I get here? Why am I taking 20 pills a day?
Is it ever too late? I mean, somebody watching this that's been on opioids, Vicodin, whatever, for many years, that they could come in, maybe get some of this, you call it neuromodulation or spinal cord stimulation. Yes. I don't know if that's the same thing. Could we start there? How does it work? Like, you're implanting something into the patient. Go ahead and tell me what it is.
Yeah, great question, because think about it like this. When you have pain anywhere in your body, but let's just say back pain or sciatica, for example, that pain is transmitted by a nerve. At the end of the day,
transmitted to the brain.
To the brain.
Okay.
There is a nerve cell that is sending a pain signal so that your brain processes that pain. If there is a way that we can interface with that nerve cell and either block it from firing a pain signal, turn it off from firing a pain signal, I think that could be beneficial, right? And so if we can do that, which is exactly what spinal cord stimulation does, it sends a repeating electrical signal to that nerve cell so that it doesn't process the pain.
We can block the pain. Confusing the signal to the brain so Correct. They don't feel pain, or
Correct.
What?
In one way, it confuses, or another term you could use is it blocks that signal.
Okay.
It sends, for lack of a better term, electrical noise to the nerve cell. So something funny, if you all remember from high school biology, a nerve cell sends an electrical signal from nerve cell to your brain. Some people call it a synapse, some people call it an action potential. Anyways, there's an electrical chemical signal that occurs. This device can interface with that nerve cell transmission, and then we could change it. We can modulate it. That's why it's called neuromodulation, is that we can modulate that nerve to make it do something different.
And this is something you do every day in your clinic?
All the time, every day. It's a very common procedure that's done, but the thing is, I just feel that a lot of people don't know about it. A lot of people are sitting at home right now suffering with back pain.
So would you say that there's tens of thousands, more than 100,000 of people that are in pain that would be candidates for this type of treatment that just don't even know it exists? That means there's people suffering that don't have to be, is my question.
Oh, yeah, for sure. As I mentioned to you, we have a huge pain population in the state. That's why we're so crippled with the opioid crisis. That just tells me that, from a demographic standpoint, there's a lot of people out there right now suffering in pain that don't need to be.
Is that right? So that's fair to say over 100,000 in the whole state?
Oh yeah, I think in our Dayton market, there's easily tens of thousands of patients, if not even close to 100. Because if you look at the statistics, Time Magazine actually ran a story a couple of years ago that said, at some point in your life, you have a 36% chance of suffering from severe debilitating pain. 1 out of every 3 people. And you just think about the people that you know, your friends, your family. Look, there's always someone out there that's hurting, right? And there are opportunities out there to get them better.
So this is great for nerve pain. I mean, it's from the nerve.
Yeah, from the nerve. And, it's just been so rewarding for me. For example, I had a patient that came in, severe back pain going down his leg. In fact, his pain was so severe that if he just touched his leg, he had just a sharp spike of pain. Wow. He was a factory worker at the old Moraine assembly plant, the GM assembly plant where they made the SUVs, developed back pain over time, severe leg pain, and we did this spinal cord stimulation technique. And the first time we turned it on, it changed his life. In fact, from my office, he called his wife on his cell phone, had her on speaker, and he said, "Honey, you would not believe what I'm doing right now." And he started smacking his leg. And I could hear her because we were on speaker.
Okay.
And she said, "Oh my God, it's a Christmas miracle." Truly. True story.
It's nice.
And for me, it's incredibly rewarding, by the way. But for him, it changed his life.
You do a trial. What does that mean? Like you're testing it in the office. That's the part I'm not getting.
Right. So spinal cord stimulation is done in 2 phases. The first phase is a test or trial. The reason why we want to test it is we want to make sure it works.
Okay.
Okay? It's like dipping your foot in the pool to see what the temperature is, right? We want to make sure that this device is going to work for you. So we test it. The test is just done through a single needle stick. We test it out and see how it goes.
In the office.
In the office, not a big deal, right? So we test it, we turn it on, we make sure you get pain relief. And if we get pain relief, that tells me a couple things. It tells me I can interface with that nerve and I can block it from firing those pain signals. Now, if that works during the testing phase, then we do what's called a permanent implantation, where we bring them back for a second phase procedure. That procedure takes about 20 minutes, but essentially we're taking a small wire and burying it under the skin so it can run this stimulation algorithm continuously. That procedure is reversible, so if you ever wanted it out for a reason, it can come out. It's not major surgery. Go home the same day.
So with that particular patient, so he's obviously in pain. You do this test under the skin with this like a little lead wire kind of a thing.
Correct.
You hit that nerve,
Yeah.
block the signal, and right there in front of you, I'm just curious if this is how it works. So he's going, my pain's gone, or it's almost gone.
Well, for him, that was the case. And for a lot of people, that's the case too. Sometimes it does take a day or two to like I said, to actually adequately interface with that nerve. I got to tell you, Randy, this is a huge part of my research. In fact, I've actually invented my own type of algorithm for spinal cord stimulation.
Okay.
As I mentioned, we have that research thing on our campus.
Now, if you're on Medicare, Medicaid, PPO insurance, HMO insurance, I mean, everything we're talking about is pretty much, this is covered.
Correct. It is covered. Right? It is covered by government insurance, Medicaid, Medicare, and the private pay. So if you have insurance, it's highly likely that this will be covered.
And most people don't know that they could see an interventional pain management physician.
That's correct.
Is that
you
right?
You can see them without a referral, right? And that's the thing. Some people think, oh, I need a referral.
But don't they tend to go, like, they don't go to your path, meaning, you got primary care physician when it gets really bad, maybe you go to the neurologist, then you go to the orthopedic surgeon, possibly looking at surgery, and you guys are kind of left out? I mean, I'm saying this. You've never told me this. But does that happen?
I think it certainly probably does happen, and maybe patients don't know the pathway on how to get to see me.
But they don't, they don't need a referral. They can go to your website and just
that's right.
get evaluated.
So in today's day of technology, you can go to my website, which is just ohiopainclinic.com, or even if you Google my name, Dr. Soin, pain management or something, I'm sure you'll find my website there pretty easily. But all over my website, there's a little icon that says book appointment. You can literally just click it directly, type in your name. You can even select a time and a day, and then my office will contact you.
Is that right?
Yeah.
And so could you give us a recap of some of the back pain issues that spinal cord stimulation is good for?
If you have sciatica, back pain that shoots down the leg, or pain across the back, anything from nerve pain, these things can be helpful for. Or if you've had surgery and you still have pain, typically those patients are great candidates.
Like a fusion surgery?
Like a fusion surgery or something called a laminectomy where they cut out bone. In fact, when you look at the research studies on spinal cord stimulation, those people tend to do the best. Chronic nerve pain, diabetic neuropathy, there's a study that's going to come out this year that shows it's beneficial for that. In fact, one of the hospital volunteers at Soin Medical Center, I see him every day when I walk in, and he wheels the wheelchair with people when they first come in. Severe neuropathy in his feet. We did spinal cord stimulation on him, and I see him up walking around all the time now.
So for some people, it's a big miracle.
Yeah, it can change your life, right? Get you functional again, get you walking, get you moving. When you're in pain, it's like a vacuum, right? Sucking the energy out of your body.
Is that what they tell you?
Well, that's just what my patients tell me. You can't think, you don't experience things the same way because you're always so focused on the pain. And if you just get rid of that piece, you have more energy to do other stuff. And your brain can focus on.
Well, I think everybody's been in a little bit of pain. And when you're in pain, you don't feel like starting a business.
Yeah.
You're not motivated to go and do things or go have some fun. It's just life is kind of blah.
Yeah.
I think I told you I had a little bit of sciatica for about a year. It went away. But during that year, it's like it was hard to be present.
That's right.
When you have pain.
Yeah.
So that's reversed all the time. Like every week you see reversals?
Yeah, that's right. And so we see people getting back to their functional lives again, spending more time with their family, spending more time with their kids, doing things that they want to do, not letting the pain rule their life.
Are you seeing more people? So for example, you got the couch potato crowd that just through, I guess, they're breaking down as they get older, maybe poor diet, poor lifestyle, etc. But then you have that weekend warrior crowd. Does it work on both? Does it work on one better than the other? And our younger patients, these weekend athletes that are beating themselves up, is it good for them?
Well, it certainly works on both. And when we're talking about nerve stimulation, if I can find the nerve that's causing the pain and we can stimulate that particular nerve, a lot of times we can turn off the pain, or at least, bring it down considerably, which is a great opportunity, whether you're a young weekend warrior or, a retired person that likes to sit in the rocking chair, read the newspaper, and hang out with their grandkids. It's certainly an opportunity.
So when you do this test in the office to see if it even works, like if you're going to the pain generator, right? Yeah. You're saying, okay, we hit it. Pain went away. So then they come back and get the permanent one put in. Yeah. And what's the downtime on that? I mean, once it's put in, if everything goes right,
they go home the same day, right? Outpatient surgery. They go home the same day, and about a week later they come back in. We do put a couple of sutures in there just to make sure everything's closed. We take those out, and then we program the device a second time, because the device is an electronic device that has to be programmed to your specific nerve. So we tweak that, and then usually after that week you're good to go. That first week we kind of like you to take it easy. You could do your normal activities, drive a car, run errands, but we want you to avoid excessive lifting, twisting, bending, stooping, those types of things.
How old
you can still work
to do this, by the way? Could you be 80, 90 years old to do this?
I've done them on 90-year-olds all the time. It's a very common thing. So there's really no age restriction on that.
So if somebody's watching this and they're going, I've been in pain for 20 years, in and out of pain clinics, had injections and prolotherapy, and you name it, they've had everything. And they may be saying, how come nobody's ever told me this? Do you hear that with patients?
All the time.
I've never heard of this before.
Oh yeah, all the time. And I think it just boils down to either lack of awareness or just not being told about it, not knowing about it. I mean, there's a lot of things in medicine out there, right? And we may not know about all those things.
So, and we're going to move on to this other procedure for spinal stenosis. But final words to somebody that maybe they've heard a little bit about, this spinal cord stimulation, or they think, I'm skeptical. What do you say to them?
I think it's important to learn more about it. Feel free to come in and we can talk about it and talk about the risks and benefits and all of those things. But remember, the testing trial phase is done through a needle stick, right? And most of the time we only do one stick, one needle insertion. And so...
and is this all done under a scope of some sort?
Yeah, that's right. It's done under X-ray guidance, so we can visualize and see where we're going the whole time.
Okay.
The patients are numb, so they don't feel or discomfort when we put it in.
Oh, so I didn't know that part.
Yeah, so that's a big part.
Numb. You left that part out.
Yeah, that's an important part.
So it doesn't hurt.
Yeah, correct.
And they get to try it out first.
Yes.
It seems like everybody would want to do it.
Right. So you try it, so you know what you're getting into. Because sometimes when we do surgery, we think it's going to work. We don't actually know. Like when you go in for back surgery. We think it's going to work, but you sign all these forms, right?
Okay.
These informed consent forms saying, oh, by the way, this thing may not work. But here with spinal cord stimulation, you get to test it first so you know.
That's nice.
Yeah.
Takes a gamble out of the procedure.
Yeah.
Obviously. Do you have people that were scheduled for like fusion surgeries or other major back surgeries that because of spinal cord stimulation, they were able to avoid that?
Yes. The one thing I do want to say is if you do have some sort of problem with your spine that needs to be corrected. So for example, you have some sort of instability that if you don't get it fixed, something bad might happen. Well, yeah, then you need surgery. But the other ones, if you're just doing surgery for pain control, for just pain relief, I think about spinal cord stimulation.
And this is great for that. Interesting. Yeah. But that's the number one reason why people get these surgeries in the first place, pain relief, right?
Correct. That is the biggest reason. Yeah.
So and I looked this up, by the way, I think there's more than 500,000 fusion surgeries being done a year here in the U.S. Do you think half of those could have been treated this way if you could have caught them a little earlier?
Oh, for sure. I think around that's probably very accurate, that number. But I do want to say again, if there is some sort of defect that needs to be corrected, obviously you got to do that. But if it's just for pain control, so if the fusion is just for pain and no other reason, I'd look at a spinal cord stimulation.
Okay, great info. And by the way, they don't need a referral to see you.
Correct.
They can call and make an appointment directly.
Yeah.
And do it that way. Okay, so moving on to this mild procedure for people with spinal stenosis. First off, what is spinal stenosis? What are the symptoms?
So spinal stenosis is when your spine, stenosis means narrowing, so the lower part of the spine gets a little bit more narrow. Typically the low back is what's most affected. It's kind of a natural process when we age. One thing I can tell you
It narrows with what? How is it narrowing?
well, arthritis and degeneration and stuff like that. And think about it. You may know your grandparents or elderly people, and they were tall when they were young. And then over time, they shrunk maybe an inch or two. Well, that's your spine bones just kind of resetting as you age. And sometimes they become narrow. And this narrowing can pinch nerves. So it's hard to stand and walk a long distance. So people can't really stand up. Or when they do stand up, they start to have pain. Or they can only walk about 100 feet. And then they either have to sit down to make their pain better or lean forward. And
so leaning forward stops the pain.
Leaning forward helps because when you lean forward, it creates more space, so there's less narrowing.
So there's nerves going down the spinal column, and it's narrowing, and things are touching these nerves, and it's causing pain.
It's causing that pain. So if every time I'm at a grocery store, you're at Costco, you're at Walmart, and you see people sort of leaning over the shopping cart and kind of walking over, I feel like a lot of those people may have stenosis. I almost want to go talk to them.
So you can spot them.
I almost want to be like, hey, I think I can help you with that. So that's the problem, is that there's not enough space, there's narrowing, and it causes a lot of pain.
So how do you fix it?
Well, there is a surgical way to fix it, which is the most common way, where they do something called a laminectomy, an incision, big one, they cut out bone, and there's a big recovery time for that. But there have been leaps in technology. Okay. And one thing that we offer at our clinic or to our patients is a new type of surgical procedure called MILD, which stands for minimally invasive lumbar decompression. It's done in my office facility. There is no sutures, no major incision. There's just a small puncture. Through there, we go in, and under X-ray continuous visualization, we go in there and we can actually clean out some of that narrowing. We pull out some of the bone. We can pull out some of the tissue to, in essence, create more space. But the huge advantage, no major surgery, no big incision. You go home the same day, and it's been shown to be very effective in patients that have spinal stenosis.
Have you ever had patients that, for them, it's like completely reversed?
Yeah, amazing stories I have. I have one guy that was a reverend, actually at a big church in Dayton. And I don't want to say the name of that, but I tell you, a lot of people go there. And I met him because he told me he couldn't give his sermon. He couldn't finish the whole thing. He usually talks for about an hour and a half. And he said about 30 minutes in, you'd have to lean over the lectern, and eventually you'd have to really kind of hunch over like this. And that's kind of weird, right? I look weird on TV here. But he probably looked weird talking in front of all of his, all of his guests. And so he had bad spinal stenosis. He came in, we did a MILD. And at the end, when I see patients
did this procedure, MILD meaning
the MILD
kind
procedure.
Of clearing it out, opening it up.
Right. No major surgery, no major incision. He went home the same day, and we bring him back a week later to see how they're doing. We just put a single Band-Aid back there, by the way. I mean, it is really, he just goes home with that. And they fill out this thing called a pain diary where they say how much pain relief he got. He circled 0 pain, 100% relief. And I really remember him because he told me about how he could give his sermon that following week. Literally, with the next week, he delivered his sermon. Didn't have to sit, didn't have to hunch over.
Very nice. How long could that last?
Well, it continues to last. So I saw him in 2014, right? It's been 7 years. Now, that doesn't happen to everybody, but, because I tell you what.
But still, there's hope for a lot of people that could be it.
Yeah.
This is the other thing that pops in my head. His path could have been different. His path could have been the pain medication route.
Right.
And it would have gotten more and more and more. And this kind of stopped it at the beginning. He was able to avoid aggressive medications.
Or what if you had a major surgery, big scar back there, and he's down for 4 to 8 weeks, and maybe that would have worked, but the thing we did on him worked. I got another guy. I opened up a clinic in a small town called Hillsboro, Ohio, kind of farm country out there where everyone knows each other. The very first patient that walked into my clinic was an older guy, retired in his 80s. Real bad spinal stenosis, just a perfect candidate for it. Same story, I did it on him. Week later, he comes back with no pain. But the funny thing about it is because Hillsboro is such a small town, and he's been there forever, they have a newspaper. It's called the Hillsboro Times or Hillsboro Courier. About a month later, he was on the front page of that newspaper holding a weed whacker.
That's nice.
That's so cool, right? And he told me that this never would have been possible had we not met. And so, if you have spinal...
So he's telling all of his buddies, you got to get in there.
Yeah.
He's diagnosing his friends.
Yeah. Oh, yeah. It was great, for us and for our patients. But think about it. If you know someone that's got spinal stenosis, has got that back pain, that pain where they can't stand up and walk a long distance, where they have to hunch over on a shopping cart, or they have to sit down because of this, before you think about major surgery or pain pills, this might be a good option for you.
And many of these people literally don't have to take any pain medication in the long run.
That's my
like
goal.
that Reverend. I mean, he's
Listen.
able to just avoid the pain meds.
Yeah, he's not on anything, and neither is the other guy. And I tell you, that is our goal. So when patients call looking for a pain management doctor, we say, okay, what is pain management? And my philosophy of pain management is to manage your pain without addicting painkillers. And essentially, our goal is to say, hey, what is causing this pain? Let's fix that. Let's not mask the symptoms with pills. Spinal stenosis, you got stenosis? Well, let's fix that with this procedure I just talked to you about. Well, you got nerve pain down your leg? Well, let's fix that with a nerve stimulator. So to block that nerve from firing a pain signal. So identifying, hey, what's causing your pain? Let's go after that. Let's treat that, get rid of that.
Interesting.
Yeah.
Now, I had a medical doctor on my program, and he was a general practitioner. He goes, the problem is, we have to under-medicate patients all the time because we don't want them addicted. So the pain patients, and I'm paraphrasing slightly, he goes, they're in a bad mood and this and that. And he says, if I could just get them to go have them managed by somebody that all they do is pain, they're going to be better off.
Yeah, totally agree. And again, if you're a patient and you want to get in yourself, or if you're another doctor and you want to get patients in, my website, ohiopainclinic.com, and clicking that book now is a good pathway to get patients in. But I want to tell you firsthand, I have some knowledge in that area. So Governor Kasich actually appointed me to be on the State Medical Board of Ohio, and I was reappointed a second time, and my whole goal was to understand why we have this, pain pill crisis. And we passed some rules and regulations, and now there's kind of a stigma the other way. That's not the greatest, but doctors are afraid to write. If you're a general practitioner, they don't want to end up in prison or something for trying to help a patient by writing an opioid. So now patients are under-medicated, so they're still suffering. And if you're one of those patients, or you know of someone that's like that, consider sending them to a pain management doctor, because they don't have to suffer.
Should they go to you earlier rather than later? Meaning, it's like they try chiropractic first, physical therapy, some light pain pills. Would you love to see them earlier on? Is it like anything else? If you could see them earlier, it's better treatment?
Yeah, because a lot of times we can do things to get them out of pain quicker. That would probably save them money and time, from having to go through all those hoops before they come in. And I think they could get a better outcome.
We're out of time. I mean, and this is a very big topic. And I know you do a bunch of things. We only talked about 2 of the things in your toolbox to get rid of pain. Final message though, somebody watching this, they're in pain, they're skeptical. They're going, I don't know, I have a good doctor. I've never heard of this before. Or they're just afraid, I don't want something implanted in my body, but they're in pain. What do you say to them?
The thing I would say to them is to come in and get evaluated, because there could be an option out there for you. You don't have to suffer.
Okay, good. Dr. Soin, pleasure to have you on the show. Good stuff.
Thank you.
All right. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.